Hawkswell, Chief Executive Officer of TheraPsil, a nonprofit coalition whose work aims to help Canadians in medical need access legal psilocybin and psilocybin-assisted psychotherapy. Spencer, it is really great to have you with us today. How are you doing?
I am wonderful. Thank you very much. And it's absolutely a pleasure to be on the podcast.
The pleasure is all mine. So we are here today to talk about a few things, notably some really exciting news that's coming out of your organization just today. But I would love it if we could start by learning more about you and about TheraPsil. Can you tell our listeners who you are and what it is that you do?
Yeah, absolutely. So my name is Spencer Hawkswell. I'm the Chief Executive Officer at TheraPsil, but I'd say first and foremost, I'm a patient rights advocate and lobbyist. And that's really how TheraPsil came about. And I'll just tell you quickly the story. I had actually gotten back traveling from India. My own personal background is more in like organizational management, running teams, sales, marketing. But I had gotten back from a bit of traveling and soul searching in 2018-19. And during that time, I'd read How to Change Your Mind by Mike Pollan. Much before that, I'd always been reading books. I think one of the most influential was Food of the Gods by Terence McKenna. And so I always had this, real interest in psychedelics, and being a psychonaut myself, taking a lot in India and Asia, Thailand, coming back they were definitely on my mind. And I knew that in Canada, we had the ability to legalize them. So my mom was a palliative care nurse, ran the mental health and addictions unit in Ontario, Toronto. And upon coming back and telling her about all the things I wanted to do and showing her some of the research, she said, you're crazy if you don't try and get these psychedelics to people who are in palliative care, because, when 80% of patients are responding favorably and seeing clinically significant decreases in their end-of-life distress and anxiety, it's like only palliative care nurses and doctors would be able to understand and comprehend how substantial those numbers are. Like,
Sure.
80% of treatments, or like no treatment is 80% effective,
Right.
Especially not something that's dealing with mental health. So, I thought I'd make a little business, either selling mushrooms or trying to help people get access to this therapy. And that's when I found Dr. Bruce Tobin and this little website he had called TheraPsil. And Bruce is for anyone who doesn't know Bruce yet, he's a 73-year-old psychotherapist out of Victoria, so from the far west coast of Canada. He's a kiteboarder. He's probably kiteboarding right now as we're recording this. And he's also a fantastic psychotherapist. And he had a couple patients that he was working with who were at the end of their life and who wanted access to psilocybin. And so he had put together this website essentially saying, I'm going to sue the government because we've been asking them for compassionate access to psilocybin for these patients who in Canada have the right to die, right? And with the support of their doctor are now requesting access to psilocybin. So I saw this guy and said, this is the man. This is him. This is who I got to go work with. And so I drove out to Victoria, met up with Bruce, and over the course of 2 or 3 weeks, we put together the plan for a nonprofit called TheraPsil. Using the name of his website, TheraPsil means therapeutic psilocybin.
Sure.
And we thought that it would rest on 4 core pillars. The first being advocacy, so that lobbying. The second being professional training, so getting therapists trained to deliver the therapy. The third being public education, so the merits and limitations of psilocybin. That way we weren't, trying to say that it's one, miracle pill. And then the fourth being research, which we'll get into a bit on this podcast. But yeah, that really is the essence of TheraPsil. It's a nonprofit that's made up of patients and healthcare practitioners. And its goal is to get people Canadians access to medical psilocybin. And our hope is to do that through regulations.
Excellent. Thank you for the background. And so we're obviously both in Canada, and I've been part of the space for a while now and been hearing TheraPsil's name for almost as long as I've been interested in psychedelics professionally, at least. And so TheraPsil today has a lot of notoriety up here in Canada. And I understand that your group was responsible for securing the very first legal access for end of life patients back in 2020. Can you tell us a little bit about that?
Yeah, absolutely. One of the major benefits of being a lobbyist group and being a nonprofit is we have incredible access to MPs, policy advisors. We speak, almost weekly with folks within Health Canada and within, government in Canada. And they're the ones that are guiding us because, we always think that, it's us against the government. Yeah. I honestly think more than half of the people in government want to see medical psilocybin. And they've been advising us and us them. So when we started, it was very clear that psilocybin would be treated like cannabis in Canada, and that all we needed to do was put individual patients in front of the Minister of Health and make a request for access. And if we would do that, then the Minister of Health would have absolutely no choice but to say yes. And we went around trying to raise money, telling people about this plan, letting them know it would work. And I don't think too many people were as optimistic. Not many people thought it would work. But we did it anyways. And after, it did still take a while, about 3 months of advocating, we did secure with Thomas Hartle and Lori Brooks the very first Section 56, which represented the first time ever in Canada that legal psilocybin treatments were done. And that was back in 2020, August 4th. So we're almost 2 years after that. And that was the very first time. And that's when we started really getting that attention. People noticed that the way we were operating was sound, that advocacy would be the right way, that we didn't need, research and clinical trials to get access to psilocybin in Canada because Sure. It is a right. And so a couple months later, we did the exact same thing for healthcare practitioners. We put the doctors and therapists in front of the minister, literally with videos every single day saying, "Dear Minister, I've been waiting, 100 days to access psilocybin for training so that I can treat my patient." And sure enough, Minister Patty Hajdu at the time granted those exemptions for healthcare practitioners around the 1st of December of 2020. And that's what also launched our training program, where we've trained now over 200 healthcare practitioners to deliver psilocybin-assisted psychotherapy. At a time, we were able to get exemptions so that they could do an actual experiential session.
Sure.
And at this point, we're actually suing the government, suing the Minister of Health right now through a judicial review, trying to get those same exemptions for the other healthcare practitioners, because we've got a new Minister of Health, Jean-Yves Duclos, who
Sure.
doesn't seem to think access for doctors is very important, which we very much disagree with.
We very much disagree with that as well. And as part of the work that we do to train clinicians and therapists, we're strong advocates of the role of personal experiences in delivering these medicines. So we're singing from the same songbook. So just backing it up a little bit, looking at the way that Canadians receive access. Access is possible to psilocybin in Canada today legally under what's called the Special Access Program. And while the access is technically achievable, it's not easy for people to get under the current regime. And your work with end-of-life patients is really part of a larger sector effort to access for specific populations in Canada, right? There's some other work that's occurring. Like there's a group called Apex Labs who are focused specifically on the veteran population. And there are people who are focused specifically on microdosing. So there is a lot of collective interest to ensure people who need these medicines most can access them legally. And so for the listeners who aren't familiar with the process that Canadians have to go through to navigate, these waters and obtain psilocybin legally, can you explain the Special Access Program and how it works?
Absolutely. And first, just to jump in there, I will mention that there are technically 3 ways that you can access psilocybin. The first is clinical trials, like the most classic route.
Right.
They're expensive. They're hard. You've got to get ethics approval.
Sure.
Total, challenge. That's for like big organizations, lots of money. The second is Section 56, and that's what we were getting access for. So just specifically asking the minister, it's still possible. Many people think that because the SAP came around that canceled Section 56. Not true at all. Section 56 remains open.
Interesting.
Completely possible. There's no policy that's been made to say that you have to do SAP first, but nonetheless, the government has been using SAP to ignore the Section 56s and use it as a bit of a distraction. So,
Interesting.
so that does bring us to this SAP, which stands for Special Access Program. It is a program that is made usually to get people access to, experimental cancer treatments that might be available in Asia or Europe or South America, but not necessarily available in Canada because they haven't passed the necessary clinical trials or process to become approved in Canada. So that makes sense when you've got a patient who has a life-threatening illness, and you say they've tried everything, it didn't work. We want to try this drug that's only available in like Germany or something like that.
Sure.
And so usually that works, right? The doctor needs to get the patient a prescription, and it's between the doctor and the patient, and it's really the doctor leading the way. Now, when it comes to psilocybin, not many doctors know much about psilocybin, let alone about psychotherapy. So this is all of a sudden being used for something completely different, right, than what it was designed for. Again, the application was usually for a drug, sometimes a prescription, whereas now we're asking these same doctors to essentially take the lead on the psychotherapeutic process with psilocybin. And they're kind of like, whoa, we're not trained for this. We don't have time for this. Like,
sure.
We have to be there for all of the treatment. Anyways, you can see how it's a bit difficult. But essentially what we have to do is support a patient through an intake process. So first qualify out of the 15 to 2,000 patients, 1,500 to 2,000 patients that are on our wait list right now. Try and qualify and figure out which ones are able to use the special access program. There are a couple conditions that need to be met. Primarily, they have to be end of life and or have treatment-resistant depression. Those are the two kind of categories right now. Anybody else looking for access through the special access program will be denied and have to go the clinical trial or Section 56 route because there needs to be a certain amount of clinical evidence to support the doctor's recommendation to use psilocybin. And right now, the only two places we're seeing enough clinical evidence are for the treatment of end-of-life distress and or treatment-resistant depression. Okay. So we've got to qualify the patients into those two categories and then figure out which ones are able to get the support of their doctors and or some of the doctors who have been through our training program. And as you can imagine, in Canada, I had to go to a doctor's appointment this morning, and it was difficult enough to do that. I've been trying to get a doctor for the last probably 6 months here in Vancouver. So now we've got end-of-life patients looking for a new doctor who's trained with psilocybin and or willing to support those exemptions. It becomes an absolute nightmare. Yeah. And the unfortunate truth is that for many patients, they will die before they find a doctor who's able to support them. And it's because of this SAP process that people will be denied access to psilocybin. It's too complex.
Sure.
And that's really unfortunate. But for those who we are able to find doctors, we usually get that doctor to support about 8 patients at a time in what we're calling a treatment hub. And then around that doctor, a number of therapists who either did training with the doctor or in our training program will work to support those patients either individually or in a group setting. But, it's a lot of work, right? That doctor needs to trust those therapists because it's the therapist that will be, doing the treatment, and that doctor, the whole while being responsible for the outcomes. Sure. So it really becomes this like team kind of group session or working session that kind of forces this either forces the SAP to only be used in treatment hubs like the ones that we're making more locally or in clinics. But that really is the process, right? It's filling out forms, making sure that you've got a team ready to treat the patients, submitting the forms, which usually take about 3 to 4 hours to fill out, and then waiting to hear back from the government on whether or not it's a yes or no.
So not terribly efficient.
No, it is horrible.
Yeah.
Horrible.
A good friend of mine has actually applied for the SAP, and I've heard not only how onerous the process can be, to your point, it's a mountain of paperwork, but it can also effectively re-traumatize patients who are forced to detail the very depth of their suffering connected to their trauma or illness in this process to try and get psilocybin. So it's terrible for them. And to your point, I know I've heard stories of other people who desperately need access, but have chosen to bypass the process entirely because time just isn't on their side and they can't afford to wait any longer and seek support in the underground instead. Uh, do you know how many people roughly are waiting for SAP approval and how long it takes today to get approved once the application is submitted?
So this is part of the difficulty is there is a lot of back and forth between the government because, as far as the test of whether or not you can be approved for SAP, it's arbitrary and it's up to bureaucrats. And they'll say, no, it's not. No, it's not. And then we send in an application. They go, oh, you haven't tried enough treatments before. And it's like, why are we arguing with a bureaucrat? Why is a doctor arguing with a bureaucrat and that bureaucrat saying, you haven't tried enough treatments? It's like the doctor's the one who decides when the patient's tried enough treatments. The patient is the one who decides. I'm working right now with a 25-year-old woman who's trying to get access, and her and the doctor are like, we don't want to try antipsychotics. We don't want to go try, all these rounds of SSRIs because it's going to take a long time. And so far the side effects have been terrible. And the government's pushing back and saying, "Oh no, you have to try those before you meet the test for SAP." And it's like that's the problem here. That's why we're suing the government. That's why we're pushing this so hard. Is like it's an arbitrary decision made by politicians, and it's not patient centered. It's not doctor centered. And so that sometimes means that I think the first exemptions that we put through SAP, they took like 4 months to get approved. Right. Which is just way too long. And we've kind of got the hang of it now and again are like trying to better qualify and work with the patients who are most qualified. So sometimes it only takes like, a couple days to hear back from the government, like sometimes even 48 hours. But again, that's not the difficulty, right? The difficulty is finding the doctor who's going to fill out the form, finding a therapist, getting it all lined up. And so a real answer to your question of like, how long does it take? Like, if you don't have a well-supportive or a team to support you or supportive healthcare practitioners, you just might not get access, right? It's very, very difficult right now.
And so just looking at, the traditional path to getting medicines approved, through a traditional clinical pipeline, there are a number of companies in this space, like you have your Compasses and your Atais, who are working hard to secure get their drugs through the FDA approval process, get a DIN, and their strategies largely hinge on IP. But we know historically that at least in Canada, a DIN hasn't always been required to get Canadians access to certain medications, as evidence to your point with medical cannabis, which we've had access to through physicians for more than a decade now.
Yeah.
And because of all of that, you mentioned that you're putting a lot of firepower into appealing to government, and it's your position that patients' Section 7 charter rights are actually being violated as a result of the current access model. Tell us a little bit about the constitutional challenge that TheraPsil is poised to launch.
Yeah, it's done. It's being filed. And I guess the listeners of this podcast tomorrow are going to be the first to know that it's done and it's ready. And the next couple of days, you'll see it leaking out in the news.
Amazing.
Finally put together. But it's not TheraPsil's challenge. It's the patient's challenge. It's the doctor's challenge. We're just funding it because we realize, kind of like we realized back in 2020, that the only way to get access is to ask politely. And then if they say no to that polite ask, you've got to use the charter. We've got to use the courts because, if the minister does not respond with compassion, the courts will respond with justice. And we know what justice is in this country. It is access to your medicine if you need it. I could not tell you how confident both I am and our lawyers that this charter challenge is going to succeed. And that in the next year, we will have medical regulations being made for psilocybin. Without a doubt, Canadians have this right. It is our charter right to our medicine. We have a charter right to life, liberty, and security of persons. And if anybody is being denied access to psilocybin for any reason, such as, it doesn't have a DIN, we don't have the right regulations to grow it, that is political cowardice.
Sure.
It is laziness on the policy side. It is a right in Canada to have that access. whether patients are going to grow it their own or whether we're going to make regulations so that companies can produce it. And we've got lots of companies in Canada ready to produce psilocybin, some of them already producing it, like Cygen. And the only people in the way of that medicine getting into the hands of the patients who need it are our policymakers and the bureaucrats in Health Canada.
Sure.
So they can do the right thing, or they can be told to do the right thing by the courts. And so that charter challenge is going to launch soon. And my only hope, the thing that is unknown, is are we going to have to fight in the courts for a year, or are those politicians, specifically Jean-Yves Duclos, right, our Minister of Health, is our health minister going to say, okay, stop, let's not fight patients, right, who are dying of cancer in court.
Yeah.
Let's instead just do the right thing and put together these regulations. That is going to be, the great question here, whether or not the government is in a fighting mood or not. And I, for the patients that we're working with who do not have a year, I hope that the government is compassionate and willing to work with these people.
Yeah, I couldn't agree with you more. And I remember chatting with our mutual friend, David Wood, who I believe is your chief legal counsel at TheraPsil.
That's right. Yeah.
Yeah. About a year ago about the APMPR, which access, and forgive me if I mess up the acronym, access to medical psilocybin for medical purposes regulations.
Access to psilocybin for medical purposes regulations.
There you go. Yeah, there you go. And he was telling me about all the work that he and your team and others had put in to draft this set of proposed legislation that models the evolved access to cannabis, medical cannabis regulations in Canada. And I remember how excited he was about it and how certain he was at the time that it would, that it would make it through, that it was logical, and that's, there's a real shot to have history repeat itself here with psilocybin. So it's really exciting to hear that that we are hopefully on the edge of that.
Absolutely. I mean, those regulations, they probably cost about $100,000 to put together of legal time, of people's time. It was a major project and really, really well done. I mean, David took the lead on that and he did an incredible job. He is one of the most focused and diligent lawyers you've ever met. And that was his baby. And it truly is just a near replica of the medical cannabis regulations, which is symbolic, right? It's like, we don't need to go to court for the next 10 years to get where we got with cannabis, with psilocybin. We can actually just start there. And that's the idea, is that we'll start with, a framework that allows LPs and manufacturers to make synthetic and organic psilocybin. We'll let patients grow their own. We'll create a doctor as a gatekeeper system. And that's the first step, not the last step, but the first one in helping people access psilocybin. And I know sometimes that we get, criticism. We left, just so you know, we had a period of, I think, 3 or 4 months where we put these out to the public and we're looking for feedback and for review. We took all of that feedback and we incorporated most of it into the documents, whichever we could. We held meetings, we talked over it. And we hope to be able to do that again. We hope that the government will take these regulations and work with us to make these possible. Because it may not be, the full legalization that other people want, the full decriminalization. It may not be as liberal as people, as others think, but it's a starting point. And it mirrors cannabis. It mirrors what we have right now for other substances. And certainly there will be room in the future to expand it.
Yeah, well, fingers crossed over here for sure. And just like looking at a few things that have been happening in the news lately as well on the regulatory side of things, we've started to see on both sides of the border actually some evidence that our respective federal governments may be starting to make regulatory decisions on psychedelics based on scientific evidence. I don't know if you saw it, but there was a letter from a federal body in the US that was circulated this week around the anticipated FDA approval of MDMA and psilocybin. And just this morning, I saw some news that the Center for Addiction and Mental Health has received the first ever Canadian federal grant to study psilocybin for depression. So I'm wondering, do these pieces of news tell you anything about how the regulatory approach may be evolving to favor science or not? What do you make of some of these things?
I'm a huge optimist, but these news articles are not enough. And I don't want to be a party pooper or anything. Like, it's so great that the government is putting money into psychedelics, um, all in the wrong areas, though, right? Like, and an example of the KMH, like, that is an amazing grant. I'm so happy it's been approved by the government, but it's to see whether or not we can remove the psychedelic effects of psilocybin. It's to see whether or not there's something in psilocybin that is just this miracle kind of fix the depression. And to me, as a psychonaut,
Yeah.
someone who's spoken with at this point hundreds of patients who have been through therapy legally with psilocybin, the journey is the good part, right? It's like, it is the journey. It is the mind altering, the psychedelic experience, which gets you, which makes you do the work that you need to do in order to heal, right? It is the fear, it is the bad trip, it is the dragon you encounter, it's the deep dark basement that you don't want to go into, it's the tears that you have to experience. Like, it is the journey, and it feels so right in my soul that should be the case.
Sure.
So I don't know. Congratulations to the KMH team, and like, to the government too. However, that money should be spent helping the Canadians who today are dying of a terminal diagnosis, right? Who need access to psilocybin. It should be put directly into getting them the access that they deserve and they need. So great that funds are being used, but those funds should be used for the people who need them today, right? The patients with serious addiction who are asking for Section 56 and SAP access. Um, Both, right? Why not both? The government should be spending more. The KMH trial should be going forward, absolutely, but there should also be attention paid to the people who need it today. And as for the U.S. too, I just hope that is true. I hope that's what the government wants, and that they're going to be moving forward to make MDMA and psilocybin more accessible in the States. I know that cannabis access has been more difficult there. The States is just a whole nother beast.
Yeah.
But obviously, anything happening at the federal level in the States is great, right? If they're looking into legalizing, like, that's excellent, and something that we certainly haven't seen. Well, only more recently have been seeing with cannabis in the U.S. So it is great, and I'm optimistic that we're getting there. Whether or not those two pieces of news are like symbolic of it, I'd throw my eggs into more of the right to try kind of stuff, and into this charter challenge, because if that happens, then the government all of a sudden will be putting way, way, way more money into research, and it will be applied research, right? It'll be like research that actually gets people access, and looks at the effect of the substance on a much broader scale. So I'm excited for that, and I'm excited for the fall. I think there's a application process for about $3 million in CIHR grants in Canada to study psilocybin for substance use disorder. We've treated about, in the last couple months, I think of 3 specific patients, 2 with heroin use disorder, opioid use disorder, and then 1 with alcohol use disorder, who after 1 treatment saw just the most incredible changes. And at least for the 3 of them now, they've all been off of their substances pretty much cold turkey since their first trip a number of months ago. So
Incredible.
I think it's really promising, and I'm really looking forward to see how that money is spent.
Yeah. Hear, hear. And so now that we've set the stage, at least a little bit about the situation in Canada more broadly, I would love it if we could talk about your team's most recent announcement, which actually just dropped this morning, about something that you have dubbed Project Solace, which is set, if I understand correctly, to become the world's largest medical psilocybin and data collection project. Can you tell us about it?
Yeah, absolutely. So, whenever the reason that we put research into the mission statement of TheraPsil was, whenever you're doing any new policy helping anyone get access to new substances, you should always be measuring it, right? And any policy that we have in Canada should be measured to see if what the policy purports to do is actually being done. And some good examples of that, maybe some controversial ones too, is like, does removing peanuts from a school actually help or do harm? And that's a controversial one because many people think it actually does harm, right? Again, we do it out of compassion to help, but it actually seems to increase the rate at which children develop nut allergies and the severity of those nut allergies when they do run into them. So policy is a careful thing. This research is an example of TheraPsil, trying to lead the way on that research, right? Is SAP access working, right? Are these substances that patients are getting access to, these synthetic and natural compounds, are they effective? And what are patients reporting? So we want to put together a registry where people can, after they get their SAP access, sign up through Project Solace, get access to these substances, and then report back through a couple of interviews and questionnaires that we have on their experience with these substances. And it's an amazing opportunity for us not only to give feedback to the producers who are manufacturing these substances, but also to the government and the public on how the SAP process and how access to psilocybin is going. Again, this is a place where I wish the government had taken lead on this. And after they made SAP access or psilocybin accessible through the SAP, I wish they had put money towards this, and I hope maybe in the future they will. They'll see the value of it. But yeah, it's a large registry, and I'm hoping that we can get a couple hundred people this year before the end of the year access to the SAP and reporting back with some of our researchers to see what's happening.
So, and that all sounds incredible. And I'm wondering, TheraPsil's already doing really amazing work and helping patients through this process. And that's been your whole thing to date, right? So how does this effort, is there anything about it that will speed up the approval process and get more Canadians pushed through the SAP a little bit quicker?
Absolutely. So the project is being sponsored right now by Haven Life Sciences, Filament Health, Cygen, and we've got a number of other openings for other producers or anyone who wants to sponsor the project. So they've helped give us some funds that we're putting towards this patient intake process. And to matching up patients and healthcare practitioners together. So again, like just the SAP process being open, unfortunately, isn't really enough. Using these funds and using the project and the energy behind it, we're going to make sure that we're matching patients with healthcare practitioners and teams so that we can exponentially, increase the flow at which patients and practitioners are applying through SAP. So our team is now able to start running this project, and we're hoping that in the next couple of months we can see more donations come through to get more people access. But yes, this project enables this SAP access, and thanks to Filament, Cygen, and Haven Life Sciences, a lot more patients are going to be getting SAP access. It really is a beautiful thing, and I couldn't be more happy for their support.
And so looking at education, we know, and we mentioned this earlier, at Psychedelics Today, we specialize in training clinicians and therapists and people who want to work with psychedelics in their practice or want to learn how to do it a little bit better and from a more informed place. So we know that there is a huge demand for professional training around psychedelic facilitation. And we also know that lack of education by caregivers is often the biggest barrier to clients who are looking for support. Like a person might hear in the news or from a friend that psychedelics can help with their condition, but their day-to-day care team, simply to your earlier point, do not have the knowledge needed to support them. And then they just don't get the care they need. Or they don't get to go down the path that they would like to explore. So, and we'll start to see more of these conversations, especially with psychedelics being so increasingly prevalent in the media. Since How to Change Your Mind dropped on Netflix a few weeks ago, I'm sure many of those conversations are already happening. So tell us about the role of education for prescribers in this project. I read it and was really pleased to see that was a big piece of the work that you're doing here.
Absolutely. I mean, prescribers are, again, the people who need to push this forward. And so, through the training program that we already have, we've got a huge pool of prescribers. And I think that was what was most attractive to a lot of the manufacturers who supported the project, is like, someone comes to them and says, hey, I'm going to support, my patient with psilocybin. They say, well, who are you, right? Like, are you going to use our product? And is this going to be a good use of the product and of our time with manufacturers to get it to you? Do you know what you're doing? Or is this safe for the patient? Because the manufacturers, they're also equally worried, like, is this going to be successful if we send a doctor psilocybin? And so because we've trained these prescribers not only, to look through drug interactions, what comorbidities might be worrisome or interfere with the process, anything like that, we've been able to forward qualify these physicians. So when they reach out to the prescribers, they say, I'm associated with TheraPsil, I've been through the training. And right away, the manufacturers are like, great, we'll send you the psilocybin. And for any prescribers who want some training, we've got lots of available training spots, and are also working on a much smaller training where we don't necessarily train the doctor to be a therapist, but instead just give them the prescriber side of training, because that's the truth. Is although there are some doctors who want to do the therapy and want to be part of it, in Canada that's not really possible. We don't have enough doctors to be working, doing therapy with patients. At least yet. Maybe once we get more into psychedelics and see that it tends to be the last time that the patients come back, maybe that'll change. But for now, there is very specific prescriber training that's happening to make sure that the SAP process goes smoothly and that patients are safe. And that is the focus: is patient safety and efficacy of the treatment. Because at this point in time, every spot available, right, for therapy really matters, and we've got to make sure that they're done well.
100%. And so we've been talking a lot to this point about some of the issues with the access regime, some of the work that TheraPsil's doing, and the successes that you're having. I would love it if we could chat a bit about the patient side of things, and if you could share some anecdotal success that you've seen in the patients who have actually been able to get access through SAP and through Section 56. How has psilocybin improved their lives? Why is this work so crucial?
For sure, and I'll start with Thomas, who is Thomas Hartle. He was the first patient to get access and get treatment. And Thomas is a gentleman from Saskatoon who has been using medical cannabis for a number of years. Was given a cancer diagnosis, and the cannabis was helping, but he still had a lot of anxiety and had tried just about every treatment you could think of, but read a little bit about mushrooms and their effectiveness in decreasing tumor sizes. I think specifically like turkey tail, and then upon reading that, found the Hopkins study, and was like, holy shit, this would be amazing if I could also reduce my stress and anxiety and live a bit more happily. Because I think everybody knows who has ever been very stressful and gotten sick from stress. I know I have, and specifically over the last 2 years, I've met increasing numbers of people who have been anxious, depressed, and who have found that it actually has physical side effects. And so just imagine being a cancer patient trying to heal from chemotherapy, from all these treatments, and throw on crippling end-of-life anxiety and stress and anxiety on top of that. It's unbearable. And so Thomas said, I'm willing to try psilocybin, and something that's important to remember here is like TheraPsil is not a treatment organization. We don't have patients. I call them patients all the time, but they are clients, because the first thing they are is advocates. The second thing they are, is a patient in need of psilocybin. And we try to make this as clear as possible, because until we have regulations, everybody has to be an advocate first. They've got to fight for their right to psilocybin. And so we front load them with that. It's like, if you want this access, we got to come together first as like mutual or as concerned citizens, and we've got to make sure that you get your right first, and then we'll look into treatment. And that's an important distinction to make, because in healthcare, it's usually the other way around, right? It's usually like patient confidentiality. You never tell the whole world about this patient's experience, about their health condition. But that's what we had to do. We had to be like, minister, this patient, Thomas is suffering from anxiety. He's got a cancer diagnosis. He's going through chemo. And Thomas he's a fighter. He is a fighter. He was not afraid to be, loud and to open up about his diagnosis. He has YouTube videos about what it's like to go through chemo. He's an educator and an advocate through and through. And so after 100 days of fighting the minister, and I will say too that even the process of putting your life out in front of Canadians and fighting the minister, I think it has some positive effects on a lot of the patients who are looking for access. All of a sudden there's this huge amount of meaning that's been put back in their lives. And so going on this journey with Thomas and helping him get access, the day finally came when the minister approved it, when Patty Hydra approved the access. And, Thomas went into this, into his psilocybin session. And just before it took I think it's called the HAM-A anxiety scale, and was scoring like 35 or 36, which I think like 30 is the cutoff for like severe, and anything above that is like unbearable, like extreme anxiety. And he was anxious to take the psilocybin. And I think the day after the psilocybin journey, maybe for the first time in years or months, he was like 4 or 5, like so low, reporting almost no anxiety. And at least every time that I've chatted with him since, it's staying down there. And I'll speculate. I won't say that this is science at all, but he's been doing incredibly well. He's been doing so well, and seems to think that it's been easier for him to heal from his treatments and from chemo now that the anxiety's gone. And so Thomas is someone who was given psilocybin in 2020. The exemption's only good for a year, and the minister took that away from him. And it's why he is going to be the lead plaintiff on the Charter Challenge. This is a person in Canada, a Canadian hero, who legalized psilocybin for himself and other Canadians, who is now being told, you do not have the right for your medicine. You do not get it again. And he's anxious still, and still needs his treatment, once every, say, year or so.
Yeah.
And it's been 2 years, and he's looking for access again. And it's amazing to see, that side of him come out again, like the fighter, wanting to change the laws in Canada, because he's back on the case. He's still fighting his cancer, and he's now fighting the Minister of Health, and he's going to legalize psilocybin for everybody in Canada and change so many lives. It's a beautiful thing, and there are so many patients that have gone through that same experience. It's I could tell you more if we have time. I'd love to.
I'd love to hear some more. And I just like, what's coming up for me is not being able to imagine what it would be like to be in, that position, to really be faced with your own mortality at all, but then to be, on this roller coaster. And I could see how, getting access to psilocybin after fighting and being at the front of this fight could help these people reclaim some of their power in what would otherwise be a very powerless situation.
Oh, absolutely. And I want to say it's like Margaret Graham or someone, I forget exactly who says it, but whoever thinks that a small group of concerned citizens can't change the world is wrong, because it's the only thing that ever has changed the world. And it's so true. This is like 3 patients and a couple of doctors that literally legalized psilocybin in Canada back in 2020. And it's the same group that's doing it again this year. Unfortunately, we don't have Patty Hydra. She was a wonderful health minister. She's now moved to, I think, be the Minister of Indigenous Affairs. And we've replaced her with Minister Jean-Yves Duclos and Minister Carolyn Bennett, the co-ministers of health. They're the ones who are responsible, who were elected in Canada to ensure that Canadians have access to medical care, and that their charter rights are being put first and foremost importance with regards to access to healthcare. They're the ones who have denied Thomas access to medicine, and it is it gets me emotional even to think about it, because you're right. Like, imagine being in that situation. It has got to be both the most frustrating thing in the world to know that a politician has it within their power to grant you access to your medicine, to grant everyone access, but they just won't. And I'm sure there are lots of excuses. I'm sure there are lots of really good excuses for why those politicians don't have the time. And that's why I'm confident that this court case is going to say no more excuses, right? As a government, you've got a choice now. Put millions and millions of taxpayer dollars into fighting and dominating these patients and wrestling them out of access to their medicine. Show us your true colors, or grant the exemptions, right? Put forward medical regulations, because those are your two choices now, right? And we are going to see the true colors of the Canadian government. And I know that whatever those colors are, our charter will prevail, the judges will prevail, justice will be served to the Canadians who need access to psilocybin. And that is a beautiful thing. That will affect you and I one day, right? If we ever need access to psilocybin for medical purposes, and anyone listening to this podcast, if you ever find yourself chronically depressed or anxious, and hopefully one day just maybe wanting of a psychedelic experience to improve your life, to make yourself feel better, to deal with a traumatic event, you have that right. And it is people like Thomas who are going to make that possible. It's a beautiful thing.
Spencer, I've got chills.
It makes me a bit emotional thinking about it. It's a lot of hard work and time put into this by those people, and I just hope I hope they prevail. I really do.
Yeah, me too. So if anyone wants to get involved in Project Solace, how would they go about doing that?
So there are two ways, and I would say there's first and foremost, if any producers want to take part in this and help sponsor it and really get it launched and moving, just reach out to me or the people on our team. Either Julia at TheraPsil.ca or myself, Spencer at TheraPsil.ca. We're always open to collaboration. If there are any clinics that want to take part in this as well, I always try and remind, TheraPsil is a very small organization. We rely on partnerships and support and help. Project Solace is not ours; it's Canada's, right? And it's being put together by Drug Science and TheraPsil, and we're hoping to get MAPS involved, MAPS Canada too. And as many different people who are helping patients get access, right? The more folks that take part in this, the better, because all of that information is going back to Health Canada and to the public. Really, we want this to be open science. And then for any patients or people who are looking to access psilocybin, we are working right now on trying to get through a huge number of patients on our wait list. So the best thing you can do is go to our website and just get on the wait list. Go to, get access now, fill out the e-form. We will do our best to get to you. But I'll also say too, take matters into your own hands too, right? If you want access, go to your doctor and talk to them about psilocybin. Go to the Government of Canada's website, pull open the SAP application form and bring that to your healthcare practitioners and say, I want help on this, because we'll work with those doctors too. And you can come to our site and look up, how you might be able to go about finding either a therapist, or how you might be able to do the therapy with your existing therapists and prescribers. This really is something that people can take into their own hands, and we don't want Project Solace to stop people from getting access, but certainly want to capture as much of the access that's going on as possible and turn that into into information that can be used to make policy.
Power to the people.
Absolutely.
Well, Spencer, this has been really great. And I am delighted to have been able to have a conversation with you and share the news with our listeners about the constitutional challenge. That was a nice surprise for me. So thank you for trusting us with that information. And we couldn't thank you enough for the work that you and your team are doing and for being on the show today.
Oh, well, likewise. Thank you so much for giving me a platform and more importantly, the people who I represent a platform. It's, as long as this doesn't get swept under the rug, as long as this isn't ignored, if the more that this is shared around, the more impossible it is for the Minister of Health just to ignore the issue. So this is all a public courts thing, right? There are the courts, but it's the public courts that matter. It's what Canadians want that matters, and it is Canada that it is going to be the will of Canadians to get access to psilocybin.
Hear, hear. All right. Well, thanks again, Spencer.
Thank you so much.